So probably the question you're asking yourself is, can I help you? Well, I can just say I won't know until you show up at my office. But chances are very good. In other words, statistically, we help a lot of people. I would say better than 90% of the patients that come to our office, we can help. And by the way, I have a wellness practice. Yes, I treat acute care people, in other words, someone who's just hurt themselves. We treat everyone though, whether you were in a car accident, whether you were hurt on the job, but really, what we do best is help people get well. Consequently, we treat children. Now that may seem a little strange to you right now. If you know chiropractic care, if you understand the nervous system, that won't sound odd at all. But if you're really thinking that chiropractic is just about back pain and neck pain, you may not have the concept right now of why we can help children or why we would even attempt to help children. But we have a high success rate with children. My oldest patient that I've ever treated was actually 112 years old. It's amazing. I routinely treat people in their 70s, 80s, and 90s. I treat my parents all the time and my family, my wife and my family, like my nephews and nieces and my sister and her family. My parents are in their 80s and I treat them. So our practice is a very broad practice, anywhere from a few moments after they were born into their elderly geriatric years. The majority of my patients are female. Now, there may be a few reasons that we treat females more than anyone else, but I think female patients tend to take care of themselves more than men do. I love treating men, but I understand also that most of us men are hard-headed. And the last thing we want to do is go to a doctor. We think we can tough it out because we've been trained to. We've been told that by our parents maybe or our coaches, different people throughout our lifetimes. Just kind of suck it up, if you excuse that term, and go on. Don't cry like a little baby and just learn to live with the pain. Well, I'm here to tell you guys, you don't have to learn to live with it. You could stop and get well. But right now, currently, I would say the majority of our patients are female. They tend to want to get well. And they're also willing to listen to advice from someone else who has the expertise to help them potentially get well. So the wellness practice is trying to change maybe your chronic situation, get you away from the medications. Now, I can't tell you to get off the medications. Only your doctor can do that, or you can choose to do that. But I would just let you know how I live my life. And my lifestyle is to be away from medications. There may be a medication or two that you need to stay on. But if you're on 10 or 12 medications right now and you can get down to one, just think how much healthier and how much better your life would be. So what we can do at our office for you, if you choose to come to us, is to help you decipher some of the problems that you have. We have many alternatives to the medications. We have many solutions to help you. We have detoxification solutions. We have nutritional supplementation that are designed to help you target specific areas of the body. So if you want to get off your blood pressure medication or your cholesterol medication and find a natural alternative solution, we have that available for you. I also know many, many people who are both medical doctors and alternative healers that can help you. So sometimes we have to refer to another physician, and we're happy to do that. What you need to do is create a team of people that are there to provide you with the best answers. In other words, it might not all be just one answer. You might have so many problems that we need to incorporate other healers. Maybe you need acupuncture along with chiropractic. Maybe you need nutritional supplementation. Perhaps you need to have massage along with it. Maybe you need reflexology. There are many, many choices and many people who are willing to help you work as a team to get you well. If you have one person in your life that's telling you, no, don't do this, then I suggest you think about talking to that person seriously. If that's someone in your family, you have the right to choose the kind of care that you want. It's your life. No one's going to care about you as much as you do. If you have any doctor, I don't care if it's a chiropractor, another chiropractor, a medical doctor, a naturopathic doctor, a homeopathic doctor, I don't care who it is. If they're telling you that they have the one and only solution to your problem, I'll tell you they're wrong. There are many of us who need to work together to find the right healthcare choices for you so that we can get you well.